Hey everyone, this is Dr. Mandy LaGreca, and I am here with a very special guest, Dr. Neil Nathan, who is basically the writer of the book Toxic. And I mean, he's got a big background, but I'm primarily focusing on that book because that's the one I've been reading recently. And it's very, very eye-opening, and I think very relative to every single one of you that is watching today. Quick background about Dr. Nathan. He has about 50 years of experience as a board-certified medical doctor, board-certified in family medicine and pain management. And he is the founding diplomate of the American Board of Integrative Holistic Medicine and ISEAI. Did I say that correctly?
Yeah, we just pronounce it ICI.
ICI, got it. And he continued his studies of conventional medicine, but in his practice and experience, he had noticed there were patients that were getting stuck, and we talk a lot about this stuck theory. And he felt his job was to find out why and to investigate and to find a better way for these people to heal. Now, one thing that he said today that really resonated with me was when I asked him why he wanted to go in this direction with medicine. He said, I just wanted to be a healer. And when he went to medical school, it was not what he expected when he came out. So that was, for those of you listening, probably can resonate with that quite a bit. With that in mind, he added osteopathic manipulation, acupuncture, hypnosis, homeopathy, therapeutic touch, prolotherapy, herbal and botanical remedies, Reichian therapy, along with a wide variety of new medical devices to his tool bag, which I talk about a lot with a lot of my patients about how it's important to have a toolbox of different modalities of healing. So during the last 10 years of his practice, it became clear that he can help more patients by expanding his role in teaching and mentoring and sharing what he's learned with many healthcare providers as well. And he also lectures nationally and internationally. So without any delay, I want to come and welcome Dr. Nathan to our interview today. Hello.
Hi. Thanks for having me.
Thanks for being here. We are really thrilled to have you. So you are now retired.
Well, no one thinks I'm retired. I'm semi-retired. I'm doing a large amount of consultations, writing 2 more books. I do a lot of mentoring and a lot of teaching. But as of April of 2021, I am no longer seeing patients in the office.
Got it. That's the best way to do it. Still educating, still doing what you're passionate about. And that is healing and helping educate people on how they can heal. So first question for you, and I kind of gave a little summary, is how did you get into functional medicine? And just briefly talk about your history with medicine and what got you into this situation.
So as you commented, I really wanted to be a healer when I grew up. And I was disappointed that I wasn't going to be taught that in medical school when I got there. They were going to teach me to be what I think of as a medical technician. So I didn't even have a language for what healing was. I didn't know enough. So my professors at medical school were very frustrated with me because I kept asking them questions and saying, I know this is what you're teaching me, but there are missing pieces here. And this was back in 1971 when I graduated from medical school, a long time ago. And I didn't have the language then to know now that what we were missing in medical school was studying spirituality, emotions, energetics, and how these are integral to any human being and their evolution and their healing. So early in my medical career, I was just always interested in the paces that nobody else wanted. The people who you describe as being stuck, they fascinated me. To me, that they were not, gosh, please get out of my office, I don't know what to do with you. It was in the category of, what can I learn that will help this person to get well? So each one of them was an opportunity to study them and figure out what they needed. And so that's how I evolved all of those listed things that we've learned over the years. Because with everything that I studied, this will help some of those folks, but it won't help all of them. There was no single field that would help every single patient. And so I just literally, I went and studied with anyone who I thought had an interesting idea. I spent most of what I made in the early part of my career just going all over the world studying with people. And sometimes I wasted my money. I would leave certain workshop and going, that was a bust. Or sometimes I went, wow, that's really good information. That's something I want to integrate into what I'm doing, and I need to study it further. So I just kept studying, and I guess I still do.
Yeah, I'm the same way. I think what I do is a combination of little bits of all the different people that I wanted to learn from and incorporate and includes you. And just like you all might sit through a webinar or CEU course or something, and not for me, and then or there'd be something where I'll just cherry pick areas. And that's, I always talk with my patients when they ask about, who's the best practitioner for me, or who should I go, which doctor you recommend. I'm like, it's all depends on what their bird's eye view is and what they're training. And that's from their own experience. And not one practitioner is ideal for every patient. So yeah, and I find your experience is quite diverse. And the one area that I want to spend some time on today is mold. This is an area that I think a lot of conventional medical doctors are not yet appreciating how influential it is in our chronic health crisis. I see it, I've had it, it's becoming really prevalent. So one of the questions I want to ask you is, why do you think that's happening? Why do you think we're seeing such a rise in mold toxicity?
There are multiple answers to that. The first starts back in 1979 when the energy crisis hit this country, and we started building buildings differently. We started insulating them and sealing them up so that the normal airflow through buildings, which would normally allow molds to leave, stopped. So mold could enter a building and then it would stay there. And if there was water damage to that building, it would then grow exponentially. The second part of that is our immune systems got trashed by environmental toxicity. And I don't think that the universe has quite realized how toxic the world we live in is. So we have toxicity from heavy metals, from chemicals. There are 80,000 chemicals in our environment, most of which have never been looked at from a standpoint of health or evaluated at all for safety. Then we have the newer epidemic of EMF toxicity, where again, people are poo-pieing, oh, EMFs are safe and wonderful, and 5G is fabulous and it's faster. And yes, it is faster. And yes, if you want to be connected like that, that is wonderful and it has its benefits. But it's also increasingly toxic to our weakened systems. So people have gotten weaker and weaker from a immunological standpoint. Their immune systems aren't able to process it. Our livers are being exposed to so many toxins that they're overloaded. And so the insult of mold, maybe we could have overcome that in the past. Now it's estimated that 10 million Americans have some degree of mold toxicity. It's an absolute epidemic, not yet recognized by most people in the medical profession.
Yeah, I agree. I agree with everything that you're saying about that. And the immune system definitely is tanked. And I mean, just look at what kids are eating. Just go walk into a school. I'm horrified when I go to my child's school. I have a 11-year-old and a almost 15-year-old, and birthday parties. Just seeing what they're putting in their mouth, the food coloring, and I mean, just the processed foods.
Right. And the quality of food, as you well know, is not what it was 50 years ago. Our soil is depleted. The nutrients in the food are not what they were. As I said, the toxicity, glyphosate is present in many of the major foods that people consume in excess, and it has profound effects on our physiology. So even if you eat organic, you're eating organic food that is still nutritionally not what it was 50 years ago. So it's very hard for people nutritionally get their bodies up to speed.
Yeah, I completely agree. So then Lyme disease, let's layer that in there. So Lyme disease is another one that to this day, we don't know if I had it or not. The tests were not really definitive, but I think from what I'm learning about Lyme, and maybe you can correct me, we've all kind of been exposed to it to some extent, because is it true, correct me if this one, that it's not just from a tick-borne, you can actually get it through saliva and sexually? Is that true?
Yeah, but that would be really rare. I
Yeah.
don't think we're all exposed to Lyme. You can get it from tick bites, which is what is usually talked about, but you can also get Lyme through other bites of other stinging insects. You can get it from mosquitoes and biting flies. Fleas carry Bartonella, which is a co-infection of Lyme disease, and that's really quite common. So
Fleas?
yes, we
So you
can.
have a pet with fleas.
Fleas,
They could give you
correct,
Bartonella.
correct.
Wow. Okay.
That's not rare. So the CDC has now recognized and admitted that there are 400,000 new cases of Lyme disease in this country every year. So it too is much more of an epidemic than is recognized and realized. And when I use the word Lyme disease, I'm talking about not just Lyme disease itself, but what people call co-infections, meaning when you are bitten, the bite of a tick literally injects into you not only the Lyme bacteria, but also Bartonella, Babesia, Ehrlichia, a wide variety of other infections you can acquire by that one tick bite.
Yeah, I read Dr. Horowitz's book, Why Am I Always Sick, years ago. And that was when I was trying to first be introduced to this concept. So can I ask, is it unavoidable that we can be all at some point, if it's a mosquito carrying it or a fly or fleas, is it something that we can't avoid? And is it better for us to focus on building our immune system to be able to handle that? Is it, you know what I mean?
So first of all, I don't want to scare the world with any biting insect will give you an infection with bite. It's not the rule, but neither is it rare. So, I mean, mosquitoes are everywhere. Living in fear is probably worse for your health than anything.
Great.
So I don't want to carry this. You know, you got to worry out there because Lord knows what might happen to you in that outside world. You can't live in a bubble, nor should you. So with that said, I think one of our best protections globally is to get our immune system up to snuff. So yeah, I think that's what we all should be trying to do, because our immune system will essentially protect us from all of these insults.
Correct.
Unless it gets weakened.
Correct. Yeah. I like that. And that's what I try to teach people as well, because I don't know. I personally don't like the idea of annihilating everything all the time with antibiotics. You know, that doesn't sit well with me, you know, that the traditional way of going after a lot of different infections is just, let's just throw some antibiotics at it. You know, I like we have an innate immune system. Let's work on building that so we can, you know, be more resilient, because we're trying to build that resilience. Okay. So let's go into back to Lyme and Bartonella. This comes up a lot. So what do you recommend if someone suspects that they have Lyme or Bartonella or one of the co-infections and their doctor's refusing to test them? Do you have any advice for people listening who might run into this?
Yeah, get another doctor.
Okay.
Well, since I do a ton of teaching, I'm really quite aware that the majority of physicians in this country are moderately unaware of Lyme and quite unaware of mold toxicity. Both are two of the most common causes of conditions that get underdiagnosed. And for example, if you think you have Lyme disease and you go to your doctor, if you can convince them to run a test, they will run what is called a Lyme antibody test, which is pretty close to worthless. It will miss Lyme most of the time. That's not my opinion. We know that. However, it gives that physician the opportunity to tell you, I tested you for Lyme and you don't have it. Meaning a false sense of security and thinking, well, okay, they tested me and I don't have that, so I guess I just sit here and suffer because I don't know what is wrong with me. So if you had something wrong with your car and you brought it in 3 times and they didn't fix it, you wouldn't think twice about taking it to another mechanic. It's
Correct.
like, I got to have a functional car, so got to take it to someone who knows what they're doing. For some reason, people don't do that with doctors. It's kind of like, oh, they're a nice person. They seem to be caring. And I don't want to offend them by going somewhere else. But even if I were your doctor, if I was not helping you, you should go somewhere else.
Great.
It's just basic that for whatever reason, if someone who is caring for you can't figure out what's going on to the point that you're getting better with them, super simple, find someone else to do it.
Yeah. Yeah, so I always tell people too, I'm not your, I don't expect to be the last stop. You know, you might go to someone after me that you're going to learn something else from them. You know, that don't think that just because you have this one doctor, that's all you're going to do. You might have to have 2, 3, or 4 different doctors that are doing different things for you. That's expected. I always try to teach people to be in charge of their health. Don't let the doctors be in charge. You're in charge. I mean, I think in some other countries, don't patients aren't they expected to have a folder with all their files where they go to different doctors and take it with them? You know, but here we actually expect the doctors to know everything about us. And half the time they don't even know all the medications that you're taking, you know, so. All right, so that's good. So let's see. Another question I have for you is, so you have Lyme, Bartonella, mold, and you do the right tests and you identify somebody has this. I do have a plethora of people who say, well, I don't want to take the pharmaceutical interventions for this. What are your thoughts, or from your own experience, can somebody heal from any of these without drugs?
Rarely. Sorry about that. Lyme and Bartonella and Babesia are really nasty infections. They do not get cured with antibiotics like other things did. And the reason for that is that they don't grow as quickly as other microbes do. And that might seem like, well, who cares how fast they grow? Well, most bacteria that cause most infections that people have, like strep or staph, they grow many times an hour.
Right.
So they're dividing and growing and dividing and growing. Antibiotics all work by blocking that process. So it only can affect a bacteria when it's dividing. So it really matters from a treatment point of view, how often it turns over. So with strep, say, within a couple of hours of taking an antibiotic, you can have a huge impact on that infection. Okay. Lyme turns over about every 3 weeks. Bartonella about every 2 weeks.
Mm-hmm.
So you're only going to get it when it is dividing. That means that you're going to need to take those antibiotics much longer than you want to. Much longer as a physician than I want to give it to you. I don't want to give you a long-term antibiotic, but there's no other way to get at it. Doctors have told me over the years, that's ridiculous. There's no other infection that we know that does that. And they're wrong about that too, which is tuberculosis. We have known for years, it's a very slow growing bacteria. And it takes months of antibiotics to get at tuberculosis. And these are no different. So very rarely will an herbal approach alone take care of Lyme or Bartonella or Babesia. I've seen it, in my experience, 1 in 100 maybe. I'm talking about really quite rare.
Right.
So virtually everyone in my experience needs antibiotics. I do work with herbs because they're very helpful.
Yeah.
I use Dr. Stephen Buhner's approach.
Mm-hmm.
I use Lee Cowden's materials. I use homeopathics. I use a variety of tinctures. They're all helpful in speeding up the healing and making it more effective. But unfortunately, if you have Lyme, you're probably kidding yourself if you're not allowing yourself to take antibiotics.
Yeah, so when I was being treated for it a few years ago, we did some antibiotics along with the full Cowden protocol. And I had a lot of the die off. So let's talk about that. When somebody starts treating these infections, they often feel worse. Can you explain why that happens?
When you kill these bacteria, it releases the toxins that they carry. And then it's that sudden influx of toxicity that causes what you're calling a die-off, or a word we use for it is called a herx. And it happens. When we first started treating Lyme, and we're talking 30 years ago, we thought that was great, which is, oh, great, you feel horrible. It means we're killing off these bacteria.
It's working.
Exactly. But over time, we realized that if we're going at it so aggressively that you are herxing constantly, all we're doing is making you really toxic.
Yeah.
And back then, we didn't know much about toxicity. And so it wasn't included in the treatment process, and people really got sick. And often the toxicity was worse than the disease itself.
Mm-hmm.
But we've learned from that, so that if possible, and it is possible, we can orchestrate a treatment in which the herxing is minimal, so that the body can deal with the load of toxin it has to deal with better, so that you can and should be more comfortable with your treatment. If you're spending your days suffering from die-off, we're going at it much too aggressively.
Yeah, unfortunately, at that time, the practitioner who was treating me was definitely pushing me into die-off. I was horrible. I felt like I had the flu. But I remember in Dr. Horowitz's book, I learned about the glutathione with the Alka-Seltzer Gold and the lemon. And I'll tell you what, that cocktail, glutathione, Alka-Seltzer Gold, lemon, was amazing for me. It just totally lifted the brain fog. But looking back, I realize, and I really like when you say in your book, more is not better. More is not better. I want the people listening to understand this, because as a nutritionist, I have to go by this philosophy, because I can't just throw supplements at you, even if they're nutritional, because they're going to stimulate pathways that could promote detoxification, that can promote methylation that you might not be ready to do. And sometimes, people listening, they want like give it all, give me all of it now. I want to get better tomorrow. And I have to walk them off the ledge and let them know this is going to take time. More is not better. Can you explain that?
I think you just did. You're right. A lot of people are frustrated by having been sick for a long period of time. If you like, they're sick and tired of being sick and tired. And they're not ready to take the journey at the pace that their body wants it. It's not the pace that I want. It's not the pace that they want. Their body is the final arbiter of what they need and what they don't need. As a practitioner, that's what I listen to, not their patient's comments about how fast they want to get well. I'm looking at, how are you responding to what I'm giving you? Are you really comfortable with it? Is it pushing your systems too hard? If it is, I'm backing off.
Yeah.
And I tell patients from the beginning that this journey is going to take a long time, a year minimum, maybe several. And so if you're wanting a quick fix, I'm not the guy for you, because it cannot be done quickly. Simply cannot be done that way. Correct. That once you have these serious infections or toxicities, the body can't just dump them. It's had profound effects on every system of the body, and the body is very complicated. It's very enmeshed and integrated. And as you're saying, if you affect one piece of it, it has ramifications that go widely. So go slow, listening to your body. And that is all I mean by that.
Yeah, I'm on the 5th year. So I always have to tell people that I'm on year 5. So, and maybe mine was a little extended because I was doing a lot of trial and error, but it does take time, and minimum a year for a lot of people. Does age play into that? If someone's younger or they haven't been sick as long, is their healing timeline a little bit faster?
Yeah, often the less time you've been sick, the less entrenched it is, and the easier it is to treat it. Yes.
Yeah. Does when with age, because is the okay, so my understanding is with immunosenescence, as we get older, our immune system changes. So is there have you found, even with how long you've been sick, does age play a role into that as well, like someone who's younger versus older?
To a lesser extent than you might think. Children tend to heal faster.
Yeah.
But once you get to be an adult, I've seen some really, really, really sick 20-year-olds, and I've seen the same illness in 70-year-olds respond as fast.
Oh, wow.
So I'm not convinced that age plays that much of a role in healing.
That's good to hear. Yeah, that's really good to hear. Okay, so let's dive into nutrition. So what is your opinion on how nutrition plays? And I know we talked a little bit about how, our food is toxic and nutrition is lacking. But in your opinion, what do you think nutrition is doing as far as playing a role in these complex disorders?
It's kind of a big subject. I'll try to hit high points. So first of all, in all of our patients, I encourage them, especially if they can afford it, to eat exclusively organic. There are so many toxins in the foods we eat that that's a problem. Most of the conditions that I treat involve either infections or toxicity, like mold toxicity, in which eating a high carbohydrate load, especially sugars and fruits, is not healthy. So for most of my patients, an autoimmune paleo type diet is much more helpful in terms that it is anti-inflammatory as a diet. A lot of people unwittingly eat a lot of foods that are inflammatory and add to the inflammation of their infection or toxicity. So again, things like taking lectins out of those diets, it makes a big difference for them. So yes, diet plays a big role in healing. But again, that's probably another hour-long podcast.
Yeah, absolutely. Yeah. I mean, with the American Nutrition Association, which is where my credential falls under, we're big on personalized nutrition. So it's definitely a very big topic. Speaking on nutrition, I'm a big proponent of fasting, and fasting was something that really helped me early on in my healing journey, because I just was, again, stuck in this inflammation that I couldn't get unstuck. And I did a 5-day water fast, and it was really hard. One of the hardest things I've ever done, but I was really amazed by how it really shifted me in the direction I needed to go. And I loved how in your book you talked about summer and winter metabolism, and how fasting is built into our, DNA really in a lot of ways because of our ancestors and how they ate. But of course, we're come out of that because of the way we eat now, because food's available 24/7 and people are eating 24/7. So for those of you who haven't read his book, can you summarize this whole summer winter metabolism theory and how fasting plays a role in that?
Well, I don't think it's theory. I think we know at this point that that is basic to human physiology, is that we have two different metabolisms, summer and winter. Think more about when we were hunter-gatherers. And in summer, we could gather all the food we wanted. The food was abundant. We ate largely, maybe more than we even needed, maybe gained a little bit of weight in preparation for, as animals do, winter, when food was much less abundant and we were going to have to go through winter with much less on board. So we actually evolved two different biochemical pathways to deal with this. So in winter metabolism, we take what we gained in summer and we process it. We work with it, we eliminate things, we shift things around. In a sense, we make ourselves more healthy during that time because we have to. And that's kind of the basis of it. So people have found that we can stimulate some of that winter metabolism, which is anti-inflammatory, again, in the same nature, by doing some form of fasting. That's been known for a long time. Popular right now is intermittent fasting, where people will try to go 16 to 18 hours a day without eating, and that helps change our metabolism from this proliferational summer process into this healthier anti-inflammatory winter process. In fact, I just read a book. It's not going to be available till September or October. I was sent an advanced copy. It's a wonderful book. I was very impressed with it. It was called Starving in Siberia, in which this is a woman who is dying of Lyme disease, not being helped by any form of treatment. And she heard about a Russian physician who specialized in dry fasting, which is quite different from wet fasting, in which in dry fasting, you eat and drink essentially nothing for various periods of time. And she goes over knowledge about that. And I knew virtually nothing about dry fasting until I read this book. It was new to me. It was in the category of, why would a human being do that? That sounds awful. But it healed her, it cured her. And she goes into this doctor's understanding of how in that state, we literally reboot a lot of the stuck processes that went on. And you can do the same thing with wet fasting, but according to her, and again, this is kind of out of my field of medicine, it's less effective than dry fasting, which pushes those systems more.
Yeah, I'd be concerned with people with IC, which we're going to talk about next, with dry fasting and perhaps that putting a lot of strain on their kidneys. Do you think it would do that?
I was impressed with my understanding of the physiology of dry fasting. I would say categorically it is not for everyone.
Yeah, I don't think I'd want to do that.
It should not be attempted without a knowledgeable practitioner who guides you through it. And she would say the same thing, the author of this book. This is not something, because the problem isn't so much with the fasting, it's with going off the fasting and introducing fluid and foods very carefully so that you don't throw the body into complete disarray, which is entirely possible if you don't do it properly.
Yeah, I tell people if you're going to do longer than 48, 72 hours, you need to talk to your doctor, and anything over 5 days should be medically supervised. Because there's just some people who their biochemistry can't handle even no glucose coming in, because they don't have whatever mechanisms are broken, right? I mean, we know those mechanisms, and they end up getting very, very hypoglycemic. That happened to me the first time, and I passed out because I just got so hypoglycemic and my body wasn't used to being able to use other sources of fuel. I say you have to train your body to use other fuel. It's like boot camp. You exercise, you have to exercise your biochemistry. And if you're not used to fasting, you start with 12 hours, then 13, then work your way up. 16 to 18 daily is really good to stay in that. And then when you're ready and you feel like you can go long periods without passing out, then you might be able to do a 24-hour and then maybe build that to 48 hours. Don't try to do what I did. I did 5 days. I was desperate at that time. I just did the 5 days all at once, and I did pass out. I did. I fell down. I didn't hit my head, but it happens. So I always have to warn people about that. All right, interstitial cystitis. So I know you said you have some experience with that. So in your opinion, what have you seen to be common underlying factors in IC, and what's helped your patients clinically?
So with any condition like IC, you always want to know what's causing it. So any of you out there who have IC or have had it know that simply treating it symptomatically, like trying to take the pain away, is not a workable strategy. You've got to actually cure it by fixing what's causing it. So my focus has always been on what are the conditions that I know that contribute to creating it as a serious entity that you've got to work with. So first of all, two of the things that are often missed diagnostically, and we've been talking about it, are mold toxicity and Bartonella.
Bartonella.
Lyme itself, in my experience, doesn't usually cause pelvic discomfort of different types, but Bartonella does, and mold toxicity does.
Definitely.
Okay. Connected to these are an accumulation of oxalates in the tissues. And one of the things that causes oxalates, here we go again, is mold.
Thank you. I've been trying to say this to people, and people look at me like I'm crazy when I say oxalates. I'm so glad that you just said that.
Well, the problem with mold is not only are people exposed to mold toxins, but if they have been living in a moldy environment, not even currently, if you were in a moldy environment 5 years ago, 10 years ago,
college dorm,
then you may have had it start to grow in you, particularly in the gut or in the sinus areas, which is where it tends to grow. We call that colonization. So you could have moved from the place that you were exposed to mold and go, well, I moved out of there. That can't possibly be relevant to me. There's no mold where I live right now. And the issue might be, well, it might be still in your body. And those molds, particularly Aspergillus, which is one of the most common, makes oxalates. So if you have an oxalate issue, mold toxicity is a major player and needs, again, it's not a one factor illness. There are multiple things that go into it. So another component that I find common is structural issues of the pelvic floor. Not uncommon in women who have had childbirth in different ways, but also in anyone who has taken a fall to their tailbone or sacral area.
That was me, tailbone.
Common in people who are gymnasts or ride horses or things of that nature, or live in an icy environment where you slip on the ice and you fall on your tailbone. But all of those things can create a structural issue in the pelvic floor, which then interferes with the flow of blood and lymph and nerve flow and predisposes to it. And you get a perfect storm by having all of that. And then, and I know this is a difficult one to talk about, there is a high preponderance in the women who've had interstitial cystitis when they've had some form of sexual abuse somewhere in their life. And I don't want to miss that because that's still important. Often that is something that is people don't want to talk about, understandably, but it predisposes the pain pathways in the body to fire up in that region of the body where we hold a lot of old tension, old memories, old energies, and sometimes that has to be treated in order for people to make progress. So again, to review, Bartonella, mold, oxalates, structural, and emotional issues that center in the pelvis have all been the major players in my experience that when addressed, then women who've had interstitial cystitis have been able to get well.
So I've also learned any form of trauma also has played a role in that. And I believe that's because childhood abuse, even if it's not sexual, because I mean, it only makes sense to me because if you think about an animal, when they get scared, sometimes I've had my dog, when he's scared, he even defecated all over himself. Right. And so those nerves are all tied to emotions. So I've seen even someone hasn't had sexual trauma, they may have had abuse, some kind of even verbal abuse. Doesn't even have to be physical, even verbal abuse.
Correct.
Interesting. So let's circle back to mold and oxalates, because this is really, really important for me that you're saying this, because I get mixed messages from people in the oxalate community. No, mold doesn't cause oxalates. And I always say, yes, it does. It's on the microbiome of the Aspergillus. But so you are basically saying that you can actually, if you look at the Aspergillus in a microscope, you can actually see the crystals of the oxalates on its surface.
There are multiple papers in the medical literature showing that Aspergillus makes oxalates. So I don't think that that's in question. I always have concerns when people have a one cause concept of anything in medicine,
I agree.
because bodies are complicated.
Mhm.
Almost always there are multiple factors that we learn about where it's not one thing that causes it. And so be careful when someone says there's one thing to deal with and only one thing, and if you do this, then you're going to get well. Uh, bodies are bodies are way more complicated than that. Sorry.
Yes, and I want to be honest here. I'm not one of those people, the nutritionist is going to tell you to follow a carnivore diet to avoid oxalates because you may still have the other underlying factors. In fact, my research has said that it's only about 30% of the problem is dietary, the rest is endogenous. So you can't avoid all of those vegetables because they're healthy for you, and they have, important benefits. Just the nature of having plant-based foods in your diet is going to be, it'd be unsound of me to tell somebody to completely cut out all plant-based foods from their diet. And I don't do that. And so I was glad to hear you say that because I've been saying this and I get a lot of different mixed messages from different people in the community. So let's circle into glyphosate. I did speak to Dr. Senef. We had a little exchange on LinkedIn and she sent me a paper about glyphosate and oxalates. So from your experience, is glyphosate also an underlying problem here?
It is, and glyphosate is one of the nastiest things to ever be introduced into our universe. It biochemically looks like the amino acid glycine, and then we basically, if glyphosates are in our body, and believe me, it's in everybody's body in this country, you can't get away from it. It literally will replace the glycine molecules and absolutely screw with metabolism. So yeah, it's an issue. That's one of the reasons why eating organic becomes so important.
Yeah.
You just want to not take any risk of adding to the glyphosate burden in our bodies.
I did a glyphosate test on myself 2 years ago and through Great Plains, and it was higher than I wanted it to be for someone who thinks they eat healthy. I was kind of disturbed by that. So I said, all right, I'm going to really focus on this. So I bought a sauna. I started taking binders. I really started focusing on organic food. That's more expensive, but it's more expensive. I mean, that's the truth. And so sometimes you get, cheap and you don't go for organic. So I'm really going to go organic. And I just tested it again and I got it down a lot. So glyphosate is something that is, from what I understand, it's not difficult. The half-life is short. Is that correct for glyphosate? So it doesn't
fairly, but some of the biochemical changes in the body are longer lived than that. So, but the bottom line is you want to get, however, every cell in the body turns over fairly quickly. So you don't have the same body today that you had 5 years ago. There's probably not a cell in it that was there five years ago.
Yeah.
We're constantly rebuilding our bodies. So yes, it can be done, not necessarily that quickly, but definitely that is something to be avoided.
All right. And the foods that are highest in glyphosate are, besides wheat?
Well, anything that is grown in Roundup. So corn, wheat, soy products, probably the heaviest. And the problem then being those same things are used to feed the animals that we get our meat from, which tends to accumulate in them as well.
Grain fed meat.
Yeah, so it's heavy in the grain category.
Do you eat a lot of grass-fed meat yourself?
I eat a high protein, low carb diet. I eat a paleo diet, but it's as much grass fed as I can.
Great. Yeah, I try it. It's not easy to find, but if you can find a local farmer, there's actually places where they will ship it to you frozen. So there are places online where you can get your meat if you can't find it locally, and they will ship it to you frozen, and you can just freeze them. You can get like 6 months supply. That's what we do. Well, this was a pleasure. So I really enjoyed this. Is there anything else you want to share with the community with interstitial cystitis?
No, I think we've covered the major points. I might mention, although it is self-serving, that it could be helpful to you to read some of my books on mold and the relationships of mold. The easiest one to read is an ebook, simply called Mold and Mycotoxins, Current Evaluation and Treatment 2022.
Okay.
It's an update from my original book in 2016. It's about a 40-page ebook that will give you an overview of mold and mold toxicity if you don't want to read anything more extensive. My other book, which is being used as a textbook in many areas for people studying environmental health, is simply called Toxic.
Yeah.
Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivity, and Other Environmental Illnesses. And that is available as an audiobook for those people who are cognitively impaired from mold, which is really quite common. And it goes over a lot of this in a lot more detail. So
yeah, I have the audiobook. I also have the Kindle version of it. I do have your manual. I have that one as well. And there's another book you were promoting, the mold. It was about diet for mold. That was on your website. I think Julie wrote that.
You mean Jill Krista's book?
Jill Krista,
Okay.
yes. She has a
It's not nutritional per se, it's simply the naturopathic approach.
got it.
So other than using conventional medications, which Jill does use, she adds to that the whole naturopathic armamentarium, which is largely herbal in nature. So Jill Krista's book, which is very excellent, called Break the Mold.
Break the mold. Yeah.
I'd also, and for those who are interested, I have a more recent book, which is somewhat different, called Energetic Diagnosis, which is about trusting intuition in terms of learning about what you need to do or not do, and also takes the whole science of energy and energy medicine into certain medical devices that we use to measure the energies of the body, because as we talked about before, getting stuck energetically really does happen, and it needs to be addressed more medically.
I agree. I agree. So what is the name of that book again?
Energetic Diagnosis.
Okay. Yeah, you have a little chapter on that in Toxic as well, when you talk a bit about some of the different devices. Does that go into more detail in that book about those devices?
Yes, very much so.
Okay, good. That's a good one. Are these devices available for people to purchase at home as well for home use?
Amazon.
Okay, great.
All of them are available through Amazon. So should be pretty easy to get hold of.
And how can they get in touch with you? Those listening?
My website is simply neilnathanmd.com, and you can learn more about getting consultations if you want to. And for those who are physicians or medical practitioners, I do have a mentorship program where I'm teaching with Jill Krista what we have learned about how to heal these conditions, and we go over carefully on a case-by-case basis, complicated, difficult cases, teaching healthcare practitioners how to tease it apart and how to treat things and the order that they need to be treated, which is sometimes not always clear to people.
Great, great. And I will put the link to your website below in the comments. Well, this was a pleasure. Thank you so much for being here. And I hope those of you listening have gained some insight to some various topics, and especially interstitial cystitis and mold. Thank you.
Okay, you're welcome.